Hi guys, welcome back to my YouTube channel. I know it's been a while since my last post, but thank you guys for supporting me and still watching my video. And I know that my friends and family in the Philippines are also watching my video, even though you guys are not in the nursing field. I really appreciate you. So today I'll be talking about resources that I will be using to study for my NCLEX. So I am taking NCLEX-PN, and since COVID happened, there are some changes. Like first, you have to wear a mask while taking an exam. Second, the minimum questions or items that you can have will be 70, but only 60 of them will be scored. And then the maximum question is not 145 questions, but only 130 will be scored. It was compared to before. I think RNs are like 265 and PNs are 205. I don't know if the time frame changed, but now it's 5 to 6 hours. You can take it within 5 to 6 hours. I know you can take a break. I don't know when or how many breaks you can take, but make sure to visit the site and double check. Let's get into it. For me, I'll be using 3 different resources, and one is the comprehensive NCLEX-PN reviewer book that my school gave me, and this is from ATI. I actually like this book just because everything that you need to know throughout your nursing school is here. You see I have a bunch of important stuff in here, and it's actually really helpful. But of course, you have to look at different resources when it comes to lab and ranges, just because it's always going to be different. So the next one, I have the NCLEX-PN Prep Plus 15th edition from Kaplan. So right here. Okay, so I got this from Amazon. I think this is less than $50. It's really good. I recommend it. You can also access the ebook one, and they give you 2 practice questions. I only did 1 practice question, which was 145 questions. It was actually really hard, and I mean compared to the one in the book, because I didn't really read the whole book. This is not my primary resource, but I just wanted to go over it, try the practice questions, you know. So in the back of the book and at the end of every chapter of the Kaplan book, I did all the practice questions, and it was really easy for me. So I was thinking something is up. This can't be this easy. And then I took the one online, which was 145 questions. I wasn't really focused, or I wasn't really studying hardcore yet, so I took that within 2 days, and then I read rational. It was a little hard. And then I also have the flashcards from Level Up RN. I like this one, but I didn't really use it to study for NCLEX, or I'm not using it primarily to study for NCLEX, but I have all of them. I have a bunch of flashcards. So I do like using the pharmacology flashcards and the MedSurge one from Level Up RN. I think this will be very useful while you're in nursing school, just so you can get used to it, the most important stuff. So this is what it looks like. Let me show you guys. So you can see that there's like easy way to remember and stuff like that. So I do like those. So the last and primary resource that I will be using to study for my NCLEX is UWorld. So I did a bunch of research, watched a bunch of YouTube, talked to people who's also studying for their NCLEX, who just took their NCLEX, and they said that they're also using UWorld, and some of them, it was the only resource that they're using. So I was talking to my hairdresser, who was also a new grad nurse, and she said that she swears by UWorld. She only did 4 weeks of hardcore studying, going through all the questions each day prior to her NCLEX, and she said that it really helped her. answer questions even though she doesn't really know the answer. If you go to UWorld site, there's going to be different options that you can pick. I purchased the $199, which include 1,218 quiz bank questions, 2 practice assessment, and 1 reset that you can access within 180 days. I didn't know exactly when I was going to take my NCLEX, so I wanted a longer time and more practice questions and 1 reset, just because I wanted to push myself and redo the whole thing before my NCLEX date. So the way I'm doing it is I'm dividing 1,218 questions to the days prior to my NCLEX date. And so that way I can set like a target number of questions that I will do each day. Let's say I have 50 questions a day. My target goal is to do 50 questions a day. I would do 20, and then 10, 10, and then before I go to sleep, I know I would just go through my Instagram, just scroll endlessly. So instead of doing that, I would do 10 questions or 5 questions, and then the next day I can just reread the rational. So I can have a repetition and understand more and then take notes. That way I can go past my target number, and then I can finish earlier and I can redo them and do a reset. So you will actually have an app that you can download on your phone, so you can do your questions wherever you are, and you can hit your number of questions for the day. So I hope that helps. So just a quick tip, stick to what you know it, trust your instinct, do not change your answer, know your lab values, ABCs, Maslow, Piaget, Erickson's developmental stages, stable versus unstable, your ADPI is really helpful, especially with priority questions. Even though you don't know the answer, always assess first. You're not a doctor, so always assess first. And then what else? Just try to write down your lab values over and over. I'm still trying to remember them, and also Erickson's developmental stages. I do forget them sometimes. So yes, we're on the same page. Thank you guys for watching. I hope you enjoyed the video, and I hope my resources and my study tips will help you study for your NCLEX. So if you have any questions, you can comment down below, or you can message me on my Instagram. Thank you guys.